Welcome again to Skin Confessions with Dr. Hodge.
Hi, Tal. Good to be back.
Nice to see you again.
It's great to be
It
back.
was a couple of weeks, and
right.
we was working in the last few weeks to bring you the second episode. We have decided to make for you episode today on something that more related to our weather outside, on SPF, sun protection, and all everything around it. Let's say
There are a number of myths that have been circulating for generations.
Yeah.
So we're going to clarify and debunk those myths.
Exactly. So like the last episode, I'm gonna clarify a few points with Dr. Hodge that she can also explain you in more from the medical field, in medical vision, also beside the aesthetic world, that we know what is true, what is false, that you can have better information in general for yourself and also for the professional that watching us, to apply it with your clients as well. Okay. Also to know what is the difference between certain product that outside there that can claim one thing and the other company can claim something else. So it will help them to understand what is actually
or understand the role of the different sunscreens, and very importantly, how they should be applied. That is key.
All right. So, like usual, we have a couple of myths to break today. So, I will start with a basic question that many people are wearing what is SPF.
Yes.
But some of them not sure, confusing, and there is a bit disinformation in this subject.
Yes.
Okay. So my first myth that I would like to clarify, that there is myth that saying that higher SPF mean that it's scientifically better protection.
That is a myth. The difference in sun protection between, let's say, an SPF 15 and an SPF 30 is about 2 percentage points. An SPF 30 gives you about 97% coverage from UVB and UVA, which brings us to the broad spectrum, but we'll come back to that. But SPF 30 gives us about 97% coverage protection, whereas an SPF 50 gives us about 98%. So we want to consider a number of things when you're choosing your SPF. The first thing that should be considered is it comfortable? Are you going to use it? Because an SPF 50 that will provide 98% protection will provide nothing if you are not using it. So we don't want you to get an SPF 50 that might be irritating to the skin, when there's an SPF 30 that is comfortable and you will use and you will get your protection. Additionally, you have to use enough. Now, a 1/4 teaspoon, and these are 2 1/4 teaspoon measures. This is the amount of sunscreen that should be applied in order to get the coverage that the sunscreen tells you it gives you. So if you sparingly apply an SPF 50, but you adequately apply an SPF 30, then the coverage that you're getting from that SPF 30 is better than what you would have gotten from the sparingly applied SPF 50.
So I would like, even maybe it's question that will come up after, but SPF, okay, there is a lot of disinformation also between 30 SPF to 40 SPF to 50 SPF, also in the duration, how long it's last.
Yes.
So can you also clarify and explain them why you consider the differences that it's staying long? So what is the difference exactly between 30, 40, 50 or above 50?
Yes, very, very important. Now, the use of SPF is essential to being able to benefit. I tell everyone you apply your SPF about 15 minutes before sun exposure. So you put it on and you go out, you have no protection. It takes about 15 minutes for the ingredients to be active. And what they're doing is really filtering the UV rays so that they're not getting to your skin. That is those are the organic or what we call chemical sunscreens. They're the physical sunscreen, but really they're chemicals as well because zinc oxide, titanium dioxide, these are chemicals, but they're inorganic chemicals, whereas the what we call chemical sunscreens, those are organic. So there's a benzene ring. Let me get away from that.
Benzol family.
Yes, that's right. So if the duration of action of whatever sunscreen that you're using is 2 hours, whether this is an SPF 50 or an SPF 75 or an SPF 30, the duration of action is 2 hours. Also, if you've been in the ocean or in the pool, even if you've just had it on for half an hour, when you come out, it must be reapplied because there is no sunscreen that is waterproof. There's some that are marketed as water resistant, but even the water resistant sunscreens, when you come out of the water, you have to reapply. And this is whether or not you've had them on your skin for an hour and a half or for 30 minutes. The 2-hour rule does not apply in that situation.
So, just to recap everything, we understand that SPF 30, it's last less than SPF 50. So let's say 50 SPF, it will last for 2 hours approximately, and SPF 30, it will last like 1 hour or 1 hour 20, something like that, I guess.
Technically, we should be reapplying either the 30 or the 50 every 2 hours. If you apply it before 2 hours, that is excellent.
Okay.
That is excellent. No argue. But if you're coming out of the water, it has to be reapplied, whether it is an SPF 50, an SPF 80, it must be reapplied when you're coming out of the water because the assumption must be that it has been washed off.
Okay. So very important to realize that if you're swimming, if no matter outside or pool,
Yes.
if you do activity outside,
That's right.
like
If you're
jogging,
perspiring
running,
and you're wiping the perspiration off your face, you're also wiping off your sun protection.
so need to consider it because most of the people, I think, wearing the sun protection, they can apply it before they're leaving home, but eventually after 2 hours, they're not renewing the protection.
That's
so
right.
then for the rest of the day, in the major hours, which is
Yes.
afternoon, like about 12 to 4, which is the
Yes.
most dangerous because the
Most
UV
dangerous.
rates are stronger. So this is their exposure even more dangerous.
That's right. And, you put on your sunscreen 15 minutes before sun exposure, you go to work, and then you come out for your lunch break. You have to reapply the sunscreen again 15 minutes before you come out for your lunch break because the 2 hours duration would have passed and hence there's no protection from the SPF which you applied in the morning before work.
Okay. Thank you for clarifying the point on SPF that our audience can understand it
It's
better and
important.
also to know how to explain it better to the clients. I have another myth that related to this myth that related to the chemicals inside the sun protection. There is a lot of people that claiming that sun protection, the sunscreen is harmful and full of toxic chemicals. This is why there is many product outside there that consider mineral, which is the real word for the mineral, it's physical filter. Okay, what is mean? It's product that, like Cheryl mentioned, zinc oxide, titanium oxide, copper and different type of metal, they're doing sun reflection.
Right, the sun is reflected off the skin, and these whatever gives you protection gives you protection. The fear that people have about the chemical sunscreens, they're both chemicals. The titanium dioxide is a chemical. The zinc oxide is a chemical. Yes, those are inorganic chemicals. They're the minerals, inorganic chemicals. The SPF, the what are loosely applied as chemical sunscreen, these are organic chemicals. So the benzene ring. What some clients may have a little difficulty with those sunscreen is that they can irritate in clients that are susceptible. I've not had a client who was not able to tolerate either one or another of those chemical sunscreens. So you choose one that you can tolerate. I personally prefer to have them both. So I will not have a zinc oxide on its own or the other one on its own. I like a sunscreen that has a combination of the chemical and the two different chemicals. And the reason I say this is we find that clients tend to skimp on their sun protection. I don't know why, but we say quarter teaspoon and they use a little bit and they rub it over, and really you're not getting the protection that the sunscreen says it will provide because you're not using an adequate amount. When you have both of them, they're two different mechanisms of protection, and I firmly believe, I don't have any studies,
Yeah.
but I firmly believe that having the two different mechanisms of action would offer significantly more protection. And we see this in the use of other medications, antibiotics, for example. We have different mechanisms of action that ensure that the infection that we're trying to treat will be eliminated. Same thing with the sunscreens.
So I can tell you, and I will share it with you. If anyone would like to get some studies regarding sun protection, so actually there is studies that showing that there is huge difference between physical and chemical filter.
Yes.
Because physical filter is not filter the ultraviolet light. So it can do the reflection, but usually
That's right.
what is trapping the ultraviolet, the UVA and UVB,
Yes.
it's the chemical component.
Yes. You're absolutely right.
So there is
the zinc oxide, the titanium oxide, they're reflecting the UV rays, whereas the chemical, they're filtering so that it doesn't get through.
Exactly.
So both of them result in protection of the skin from UV radiation with different mechanisms of action, and that is why I like them both together, because when you have two different ways of protecting, the protection will it should theoretically be better.
It's again, people that like to get the studies, I can provide you for this also.
Yes.
And it's 100% sure that physical protection it's less effective than both because there is no UVA and UVB protection. So it can still minimize the penetration, but there is nothing that if you have major exposure to the sun that will prevent it, which with chemical filter you do have it. So it's important to have both of them. I know that for certain people, like you mentioned, it can be more irritant.
Yeah.
So in this case, if every sun protection you tried it's irritant, you don't have choice.
That is never the case. I've had clients who've had irritation with one, and when they try something else, they tolerate that well. So this is what I encourage.
So maybe it's some certain ingredients that in some product they can be in higher percentage, in other product they will be in lower percentage. So you need to make a little research on the market, what is available there and what can works better for you. If you can take a sample in advance to try to see if it's working for you, it will be better.
And take it from someone who You know, I've used sunscreens that cause significant irritation. I will not call names of these sunscreens, but my eyes I couldn't tolerate.
Yeah.
And then there's sunscreens that they go on and there is not a problem. There's no problem.
Also, there's sunscreen that also can help you with antioxidant ingredients,
Yes,
and
that's
other
right.
ingredients that can help you to prevent damage of the environment. So it's important to see that you have the protection, of course, but there is some product outside there that can give you extra benefits
That's
at the
right.
same time.
That's right.
Okay, so there is some product that white that can be clear completely on your skin if you don't find the right color for your skin. There is people that looking more for a demi makeup protection, which they can prevent use of makeup and then to use just the sun protection. And also beside the cream, there is the solution in powder. Different companies that selling in powder as well. That it's excellent solution for reapply during
That's
the day.
right. And that's often a problem, the reapplication. And it was a problem for me too, until I got my powder and you shake it down and you apply. You apply and around the eyes everywhere, and it makes reapplication and protection.
Also on top of the makeup. So then you don't need to wash your face, not destroy your makeup for the day. You can just apply it on top of it. And again, it's just physical, but it's better than nothing. At least in the morning you can apply the cream, and then during the day to reapply the powder. If there is option to apply the cream during the day, of course it will be better and will protect you better outside from the sun. So I think for this matter we pretty much explain it very detailed and give you a few points to think about it, and even maybe check your own product that you use and to see what you can maybe find better solution for your skin. So my next question is about UVA and UVB protection. Some people think it's the same, and then they don't understand what is the difference between UVA and UVB.
They're not the same, not the same at all. And UVB is a shorter wavelength. This is what is responsible for sunburns, for tanning. And every time you either experience tanning or sunburn, you're changing the DNA in your skin, and this increases the risk of mutations, which result in cancers. Now, there are three types of skin cancers. There's the basal cell carcinoma, the squamous cell carcinoma, and the melanoma. Each of those skin cancers, there is an increased risk from tanning and from burning. Now, if you've suffered a suntan, people think that that is safe and that protects from sun damage. That is not safe, because that has changed your DNA, and any change in your DNA increases the risk of mutations. You asked me about if they are the same. UVA, we thought previously that they were not problematic, and so we used sunscreens that primarily protected from UVB. Primarily we wanted to protect from sunburns. We now know that UVA are dangerous. These are the rays that are responsible for aging. They're responsible for the sun damage, the melasma, the hyperpigmentation that you often see in susceptible individuals. I am a susceptible individual, and these also do increase the risk of malignancies, skin cancers. Again, the three types of skin cancers. Now, the UVA, in addition to it being so dangerous, what makes it even more dangerous is it is surreptitious. So you go outside, there are clouds in the sky, a lot of cloud cover, you look at your UV index, the UV index is 2, you think you're safe. You're not, because this UVA, the wavelengths, is longer, and it comes through about 80-85% would come through the clouds, and this causes damage. They come through the windows in the car, the windows in your kitchen. You're doing your dishes in front of your kitchen window, and you think you're fine because you're indoors. No, the UVA is coming down and it is damaging your skin. Also, it's not just the face. We put the sun protection on the face and we ignore the neck, we ignore the ears, we ignore the décolletage, the arms, the hands. The hands. So we're driving, the hands are on the steering wheel of the car, and the UVA is coming through the windshield, and you come, and 10 years after, your face is well protected, but your hands age you. The hands actually look older than your chronological age. So the sun protection, UVA and UVB, you obsessively protect.
It's another good point that you bring up, that many people don't think about it, but driving, it's something that we're doing every day,
Yes.
more than 20 minutes, easily a day, most of us. And most of us also changing hands, but putting on the hands on the steering wheel, which I think most of the time when you're driving, you're getting the sun on
Yes.
on the palm of your hands. Now we don't see the damage, but what is the damage that becoming later on? It's first sunspots. So you can look on your parents, and if they got a lot of sunspots here, it's because of this type of sun exposure.
Yes.
And also more type of sagginess on the skin,
right.
that the skin become
right.
more thin.
Because your collagen is being broken down. And I think our last podcast, we spoke about the UV radiation breaking down your collagen.
Yeah.
And this is what it does. It does it on your hands, it does it on your neck, your décolletage, your face. It is, you just have to protect. There's no other way.
So this is why also it's related to what we spoke last episode, that sun protection, it's not just to protect you from the sun damage, it's also to protect you from aging, hyperpigmentation, and many other stuff. Sun, it's fun to expose and feel the heat, but we still need to protect ourselves and to pay attention, because if no, later on in life, we can pay a big bill for it.
That's it. And, Tal, you had mentioned that people don't think that they're driving, hands on the steering wheel, they don't think that their hands are being damaged. If there is either a gentleman or a lady who wears a wedding band, and remember when in the beginning I said a sun tan is evidence of sun damage because you've changed your DNA. So this person wears a wedding band and they're driving all the time and they think, oh, the hands are protected. If you slip that band off, you will see the skin under the wedding band is different to the rest of the hand.
Yeah, it's like
the rest of the hand.
It's like
that
the sandal in the summer, and then it was the first week of the summer, and then you see you have white strips on your leg.
That's right.
Same idea.
Right. Yes. Yeah. So the area that looks brown and nice is actually the area that has been damaged by the UV radiation.
Yeah. So it will help you to understand again better, to pay attention to the little details as an individual or as a professional, to guide your clients, your patient. It's very important to touch in the right points, because most of the people, even professional, skipping this little details, so even reapplying the cream during the day. And as a professional, we need to to give example also to our clients.
That's right.
That to show them that we are doing this by ourselves. My next point is related to dark skin. Okay, because there is myth that, because also in general it's more rare to meet dark skin with skin cancer. So there is myth that skin cancer cannot, dark skin cannot get skin cancer, and also that sun protection, sunscreen, they are not necessary for darker skin.
That is a huge and very dangerous myth. Dark skin gives you maybe an SPF of 5. Would anybody put an SPF of 5 on and go out and feel protected? Dark skin does not protect you from UV damage. And it is also a myth that individuals with dark skin are not victims of skin cancer. Because what is a fact is that individuals with dark skin who have skin cancer are diagnosed much later, because it's not we don't
The damage
think
is slower.
it's slower. We don't think that we will have skin cancer, and warning signs are ignored. Little lesions, suspicious moles are ignored, and so our diagnosis is made much later, and so the mortality associated with skin cancers is greater in individuals with color compared to paler individuals. Now, the I don't know if everyone, if is there anyone who does not know Bob Marley? Bob Marley died of melanoma because, he grew up in the Caribbean, he lived in the Caribbean, he probably did not use sun protection, and he developed a malignant melanoma, which was the reason he died. And this is just one example, and I use that example because most people know him. But blacks or individuals with color are just as susceptible to cancer, skin cancers, as other individuals. Remember, the color gives you a protection of about an SPF 5, which really is nothing.
So again, people with dark skin
Must use sun
must use
protection.
sun
Yes.
protection.
Yes, must use sun protection. And an adequate amount of sun protection, and 15 minutes before sun exposure, and reapplied every 2 hours. Reapplied immediately after coming out of the water. If you're perspiring a lot and you're wiping the perspiration, it must be reapplied because you're also wiping off the sunscreen.
So I know that from experience with dark skin that often the issue that they cannot find something that's suitable their skin. So in this case, there is a lot of white sun protection that become completely transparent on the skin. So in this case, you need to make a little research, and you will be
That's
able to
right.
find those products.
And I mean, I have had the problem where I couldn't find something that looked nice on my skin. Because, like I mentioned, I like the combination of the chemical and the physical blocks. The physical block has the disadvantage that it's a little pasty and thick and white. And what I did many, many, many moons ago was I would add a bit of foundation, a really dark foundation, darker than my skin tone, to my sunscreen, and I would put it on. That was a huge mistake, because when you take an SPF 50 and you put foundation into it and you mix it and you put it on, you really don't know what protection you have on your skin. What you do know is that it is not SPF 50. We don't know whether it is 15
Because
or
it's
20.
mixed.
It is
reduced
mixed.
the concentration. But also, I think that maybe you didn't got a reaction, but some of this mixed of product can cause even maybe a reaction, because irritation, because you mix different chemicals, different ingredients that maybe cannot not coming good together.
That's right. And so you choose a sunscreen that will give you the protection, that you are able to use the right amount, so you're not skimping because you don't want the white overcast, but you can use the right amount, and you put it on everywhere, and it blends with your skin tone. And I have found that sunscreen, again, I'm sorry, I have to mention it. It's the Ultra Protector. The Ultra Protector SPF 50. It's a combination of the chemicals and the physicals, and it blends into your tone. For individuals who, because if you're going to be putting makeup on, again, you're diluting your sunscreen. So for individuals who do like their their foundation, their makeup, and want the protection, there is an SPF 50, the multi-needs protector. Again, a combination of the chemical and the physical blocks, screens, and with a tint, which blends very, very nicely with your complexion. And these I recommend before the sun exposure in the morning. If you're going out for lunch, yes, you reapply. And at the end of the day, you put your powder on. This is just a physical block. So, I wouldn't use just the physical block if you're going out at noon, but at the end of the day, yes.
So I have a huge myth to clarify, that it's not just related to sunscreen, it's related to the sun in general.
Yes.
Okay? And it's about vitamin D, and also that there is a myth that the sun provide vitamin D, and there is also myth that saying that sunscreen prevent penetration of vitamin D. So I would like to clarify it,
Yes.
because some people saying the sun give you cancer, and the other people can say exposed to the sun it will give you vitamin D.
Yes, and that is a very, very, very important point. Now, the sun is responsible for the activation of vitamin D in the skin. And so theoretically, if you're not exposed to the sun, you may suffer a vitamin D deficiency. However, it is a fact that you ought not to get your vitamin D from sun exposure. You have your supplements. And I advise, when I had my endocrine practice in Toronto, I would advise all of my patients to take a vitamin D supplement. And this is if they had no vitamin D deficiency. If they had no vitamin D deficiency, they would take 400 international units during the summer every day, and 1,000 international units during the winter every day. So every day for 365 days of the year, you take a supplement. 400 units every day in the summer, 1,000 units every day in the winter. However, if you suspect that you have a vitamin D deficiency, you have your levels checked, and then you need a prescription, 10,000 units, and you take, you're given a course, either 3 months, 6 months, and your levels are checked again, and then you go to your maintenance, 400 units per day in the summer, 1,000 units per day in the winter. But no one should be relying on the sun or even diet to get adequate amounts of vitamin D. Vitamin D is an important vitamin. Really, it is a hormone that it oversees the metabolism of bone, calcium, the immune system, malignancies. It is essential, and supplements is the way to go.
So I have a question. Because many people don't know where to, even if it's in supplement, where they can get this vitamin D, and there is also different type of vitamin D. So the question, if they should go to supplement store, they should go to nutritionist to consult, what you will recommend to people that will prevent wrong purchases,
Yes.
let's say.
The vitamin D is found everywhere, at Walmart, at Costco, at every pharmacy, and usually the lowest dose that you will find is a 400 international units. This you can get at Costco. This is 2,500 international units. This is 2,000 international units. This is prescription. This is 10,000 international units. And these are cholecalciferol. So this is something that will either be converted to active vitamin D or is active vitamin D. So you take it, you're taking active vitamin D, and you're keeping yourself healthy where your vitamin D levels are concerned.
So a question, if a client want to purchase how we can know what is the quantity that he should consume a day to follow the instruction on the box, or like because it's confusing, it's not like obvious what you should do.
Yes, it is confusing, and which is why I said if your levels are normal, then 400 units during the summer is adequate every day. If and 1,000 units in the winter every day. And the difference in the dose in the summer and the winter is really because as much as we try to protect from the UV exposure,
Yeah.
it still happens. And in the summer, it happens. In the winter, it does not happen because it's cold and we cover everything up, and our days are shorter, so there's not much sun to start with. And even when there is sun, there's no skin for the UV radiation to convert to the active vitamin D. So the amount in the winter, the supplementation in the winter is more than in the summer. Now, if you suspect that you could have a vitamin D deficiency, and individuals who are more likely to have a vitamin D deficiency would be darker skinned individuals, individuals who've had a previous history of skin cancer, because these individuals I know are obsessive about protecting from the sun, because they know that their risk of second skin cancer is that much higher, and so these individuals are more likely to have deficiency in vitamin D. It's an easy test that is done. You do the test, results are usually ready within a week, and it will tell us what your vitamin D levels are. And at this time, well, a physician would be the one ordering this test. So he would be able to prescribe the amount of vitamin D that you need to treat the deficiency, and then to go on to maintain these levels so that the deficiency doesn't recur.
So I guess that the best solution first is to consult with professional, and also to do blood test. I guess it can give
if you suspect that you may be you may be at risk of having a vitamin D deficiency. Most of us tend to be okay. However, I suspect that the incidence of vitamin D deficiency is going to increase, especially now that everyone is concerned about the dangers of UV exposure.
Yes. Okay. Thank you for clarifying this point. I'm sure that it's gonna help to many people, because again, it's very large subject, and not everyone have access to information or to get information. Right. So I will let you. Right. I will tell you also to anyone that watching us or will watch us, if there is any questions regarding what we talking about regarding SPF, vitamin C, or anything that you would like also to have additional information or ask another question in the same matter, you can comment us, you can send us messages in the DM. Feel free. We are here also to guide some people in their journey if they need. That's right. To provide the right information.
And the moms, please, your little children, because the ladies that I see, the ladies and the gentlemen that I see coming in with sun damage, they really didn't happen in the last 20 years. Mm-hmm. These happened as children. You go out in the sun, you're not concerned. And this is when the DNA starts changing and the damage is happening.
So I would like to clarify the last myth for today. Yes. It's a huge subject. It's something that's very popular, especially with young or light skin as well. Tanning beds. So, especially in Canada, cold countries, it's alternative to sun exposure, and there is some individual that doing this really regularly. Yes. And even using other product to accelerate the process or to burn the skin.
No, this is dangerous, and yes, I I I know a few young people who do this because they think it looks healthy. They think it's pretty, it's beautiful. And I tell them, I tell everyone, pale is the new tan. Okay? You be happy in your skin. You're pale. It is beautiful. It is beautiful. Tanning beds are dangerous. They're just as dangerous, or probably even more dangerous, I would say more dangerous than the sun. And this is because if you went out in the sun, you probably would not get a tan in half an hour. You go into these tanning beds and you come out half an hour later and you're bronze. Now, the amount of mutations, the amount of changes that this has done to your DNA, it's frightening. A tan does not protect you from UV damage. Again, as I've said before, a tan is evidence of UV damage. A tan indicates that your DNA has been damaged by the UV exposure. And repeated damage to the DNA will ultimately result in mutations and give rise to either basal cell carcinoma, a squamous cell carcinoma, or melanoma. Caught early, these are curable. Left too late, they're all deadly. So please, the take-home message is that tanning beds are a no-no. There are tanning creams that you put on, or bronzers, and you can use those. You can use those, the creams, the bronzers, so if you want to really
be darker,
have a nice look, a tanned look, go with that option, but not the tanning beds and not the sun.
I think that what people are missing, most of the people don't realize there is different skin types.
Yes.
And there is skin types that they can expose to the sun for hours or 4 days. They can turn red,
Yes.
burn, but not become darker. Why? Because in your genetic, in your DNA, you don't have the ability to tan.
Yeah.
So actually what you're doing each time that the same skin type exposure to the sun, that usually it's light skin, redhead, blonde, light eyes,
Yes.
all those people usually prone to get skin cancer.
Yes.
Now, it's very important to understand that you cannot tan. So in your case, the alternative that can be good, it's spray, creams, all this solution, but UV bed or sun exposure will not help you to become darker. You will just become red and burn your skin for nothing. Okay. I have another question that's interesting related to UV beds. That some treatment for atopic dermatitis they can recommend on UV beds to treat atopic dermatitis. Okay. Can we clarify that matter?
Atopic dermatitis. Psoriasis is a skin disorder which in the past we would use UV light to help to treat. And this is severe psoriasis. Now we have all of the monoclonal antibodies and the immunosuppressive creams that we prefer to use, and stress control, because stress is the worst thing for psoriasis. And these more effective and safer treatment options for psoriasis. Atopic dermatitis, on the other hand, can sometimes be exacerbated by the sun. Each individual who has that eczema or the atopic dermatitis, the first thing you would want to ask is what exacerbates your dermatitis? Is it the cold or is it the heat? Because it depends for each individual. Something else trigger. Yeah. That's right. And for some individuals, the sun exposure, the heat triggers their eczema. For others, it's the cold, dry air. So, the bottom line is no, we do not recommend UV beds or UV lights for the treatment of atopic dermatitis.
So for those patients that done it before, I'm sure that also maybe some of them got improvement, but I know personally some patients that try to do that, and we offer them different solution and we obtain amazing results. So even we will have also podcast regarding atopic dermatitis.
Because with dermatitis, the skin requires hydration, it requires humidity, and you use creams to help with this. And I think the Tiger Balm is excellent. It's excellent to assist in the treatment of atopic dermatitis.
Exactly. So we will come up with next episode. We are not sure about what yet, but maybe we'll find. I think that maybe the next one we should do hyperpigmentation.
I think so too. But you let us hear from you. You send us your requests and let us hear from you. And we're happy to do what you want us to do.
Of course. So thank you for coming again to
participate
in my podcast, Dr. Hodge. It was a pleasure again to do it with you.
Thank you for having me.
Thank you for everyone to listening and watching us. Like we said, if there is any question, anything else, or any specific matter that you would like us to talk about, feel free to send us message or just send us comments.
And of course, to ensure that you get these podcasts, you like, you subscribe, and you share.
Exactly. Thank you.